I want to admit everyone in. Good morning, everyone. Thank you all for being here on today. I'm grateful for everyone participation on today. And we will get started in about 3 minutes. So if you want to take a break for about 3 minutes, we will get started. Good morning. For those that are just joining, we're going to be starting in 1 minute. So if you would like to get you a refreshment or take a bathroom break, you can definitely do so. We will get started in 1 minute. And welcome to Q4 MKE Elevate Safe and Supportive Communities Action Team meeting. Welcome. Thank you for being here. Okay. We're going to go ahead and get started for those that are coming in late. We will continue to move right along. And I definitely want to respect everyone's time. So again, thank you all for being here and being on time. So again, welcome to Q4 MKE Elevate Q4 Safe and Supportive Community Action Team meeting. And again, appreciate you all taking the time to be here for this very important meeting. So next slide. So just to remind everyone of our ground rules for today. Uh, so we want to make sure that in this meeting, just to let you know, will be recorded. So everything, you don't have to necessarily have your screen on, but it is welcome. Um, our next ground rules is to step up and step back. So just being present in this space. And if you need time to just take a moment, feel free. And the next one is to respect each other's time and expertise in this space. So we want to not be here to waste anyone's time, but to be effective and intentional and purposeful about this work. We want to support each other's learning processes. So being respectful in feedbacks and expressions as for everyone that is participating. We would like to also elevate the expertise of lived experiences. We want to be ready to listen, to understand, and support. And then lastly, remember our North Star, which is the health of all people and the neighborhoods in the Milwaukee area. Next slide. And so for our agenda of today, we want to start off with introductions. And so my name is Robert Walker. I didn't get to mention that. I'm Robert Walker. I'm a public health strategist at the Milwaukee City Health Department, and I focus on mental health and community resiliency, and I am the overseer of the Safe and Supportive Communities. And I want to also shout out our co-chair, Quinn Taylor, who could not be here today and he is with the Office of Community Wellness and Safety. And so to go on, want to let everyone know that they could introduce themselves in the chat. But before that, let me go finish the agenda. So we're going to have a target setting overview and activity. Um, so we want you all to help us when it comes to our Smarty goals, as that we've been working on together collectively as an action team and work group for next year to create some target setting. So we're going to do that with our data team and our senior epidemiologist. And then after that, that's going to take the bulk of today's meeting. But after that, for time spent, we will also go into our equity activity debrief. We went over this in our last in the beginning of the year in our quarter 1 and 2 meeting regarding the MAP 2.0 power primer and equity activity. And so just wanted to share the results of that if we're able to. And then we will have the MKE Elevate out evaluation. So would love to get you all's feedback regarding the how we've done this year and how we can do better in the next coming of years. And then we're going to talk about next step, lastly, and upcoming events and any questions that you may have. Next slide. Again, so right now you can introduce yourself in the chat. You please share your name, the organization, and role. And then you can share what do you hope to accomplish with MKE Elevate Safe and Supportive Communities by the end of the year. And then you can also share what's your favorite holiday treat. And, we're going into the holidays, so you can provide that information as far as your favorite dish that you may like to make, or what do you like to actually eat. So would be a fun fact to learn more and build relationship with those that are here. All right, let's while you're doing that, we can continue on. We can go to the next slide. So want to reintroduce our vision for MKE Elevate, which is to have a Milwaukee where all people are thriving in safe, healthy, and equitable neighborhoods. So that is our vision overall for MKE Elevate. And importantly for you all being here, showing that you are committed to this vision. Next slide. All right, just some grounding again around community-driven goals and strategies. So just to remind everyone here in the action team that your voices are important, and we definitely want it to be engaging and for specifically these setting targets and for having meaningful impact in this meeting specifically because this is a community-led initiative. So MKE Elevate is just driving um, by the local voices and the needs of the community. So we have together created the Smarty goals and objectives to as far as how we developed them was together as collective. We provided the information and we got all the feedback from our quarter 4 meetings and our action team and our not in all our quarter meetings, excuse me, for our action teams and our work groups. So we want to make sure that we are focused on collaboration. So want to emphasize partnerships to effectively address key issues. So this target setting overview for today will emphasize the methods that may or may not apply to all the objectives, but is useful to know and help us to understand how we can measure and evaluate our progress going forward. So our objective specific target settings, the settings targets are selected from the objectives and guided uh, our efforts and hold us accountable. Like I said, it's just being able to measure our progress from all the work that we've been doing and planning this year. And so as we move forward into the next year, we want to um, uh, show progress in our work. So That is why we are just setting the stage here, just to make sure that we understand the reasoning for and the purpose of this meeting. Next slide. And so now I'm going to pass it to Savani. She can introduce herself for our target setting overview.
Thank you, Robert. Good morning, everyone. My name is Sivani Manchu, and I'm the Senior Epidemiologist with the data team at the City of Milwaukee Health Department. And today I'll start off by discussing some commonly used target setting methodologies, often used for outcome metrics. And while many of our current metrics are process-oriented for the first year, these methodologies can still be insightful, and learning them will help us set aspirational and realistic targets where possible. And I'm hoping that by going through these methods, we can all be better equipped to set targets that are both data informed and strategically aligned moving forward. And so as I walk through the three most commonly used methodologies, we'll look at the strengths and potential limitations for each, so you can decide what might be most applicable both to today's target setting activity, but also your future work. Next slide. So the most commonly used methodology for target setting is percent improvement, which sets targets based on a desired percent improvement or a specific number of percentage points above the current value. It's used often since it only requires one data point, and it's easy to interpret and encourages stepwise improvement, so it makes the goal feel achievable. It can also be applied across various metrics regardless of the starting point. A downside, though, is that the percent change is often chosen arbitrarily, and it might not consider external factors that are influencing progress, such as resource availability or environmental changes, and it relies heavily on that baseline value. So any inaccuracies or variations in that baseline can affect our target feasibility. Next slide. Next, we have the option to target set by comparing to a reference group. So this is often done by comparing to a state or a national average or even top performing regions locally. So some benefits that this encourages are you can set your targets based on real world examples, and it makes the goals more grounded. Targets are also already established since you're comparing to a reference group, and we can begin to look into how we can close that disparity, perhaps by looking at what's working in these areas with better outcomes. However, some downsides to this approach are that it requires accurate, comparable data from that reference group, which may or may not always be accessible, and there may be high volatility in that reference group, which makes interpretation difficult. It may also not account for perhaps unique local contexts or conditions that differ from the reference group to our current area. Next slide, please. And lastly, we have projection and trend-based targets. So this involves setting targets based on historical trends and projected future values, leveraging past performance to anticipate what are potential realistic improvements. The benefit is that this uses multiple data points and projections to provide a sense of what's achievable and reduces the likelihood of setting overly ambitious or unrealistic goals. However, this does require multiple data points and robust data analysis, which may be difficult to communicate to a lay audience and may require a lot more legwork. So those are the common methodologies for setting effective targets. And I'm hoping that today we can work together to set some specific, measurable, and realistic targets for the SMART goals that we've worked together over the past couple of quarters to that we've identified for each areas. And like I said previously, the prior methodologies may or may not apply, considering a lot of ours are looking at process metrics such as number of workshops held or number of audience members reached, as opposed to something like change in crime rates, which we will be hoping to set in the future for the long terms. But currently, most of our SMARTY objectives, as we've established, are short-term goals. So for the target setting activity, we're going to work together to try to define some clear and achievable targets for the three goal areas we've been focusing on. And these targets will help to serve us as a roadmap to success and guide how we measure progress and hold ourselves accountable. We'll also be going over implementation partners and defining timelines where needed. First, we'll start by briefly revisiting the SMARTY objectives for each goal area to ensure we have a shared understanding of where we are and what we hope to achieve. Well, here we'll look at the deliverables for each of the strategies, and these are the tangible outcomes or products we expect to produce. This will help us ground our target setting and what we plan to accomplish. Then we'll look at the quantifiable targets. For example, if the deliverable is a community workshop, we'll work towards determining how many workshops we aim to hold or how many participants we want to engage. Finally, we'll think about how are we going to track this progress? Where is the data going to come from? And do we have the resources to monitor this effectively? These considerations are going to be critical for ensuring accountability and success moving forward. And as we go through this process, there are a few guiding questions I would like you to keep in mind. What is realistic given our time and resources? Do we have access to the data needed to continue to monitor our progress towards this target? And are there any additional community partners we should be involving to achieve these targets? And we plan to spend about 20 minutes for each goal area. First, I'll spend a few minutes briefly going over the Smarty goal and the deliverables that were proposed. Then we'll break out and give everyone 5 minutes of time to self-reflect and use a Google slide that we have to jot down some ideas for targets and other proposed questions. And lastly, we'll regroup as a larger group and go over the proposed targets and aim to come to a conclusion. I ask that you please remember that this is a collaborative process and there are no wrong ideas. Any contribution you make will help us get closer to actionable and impactful targets. Next slide, please. So first, we'll start off with crime and neighborhood safety. The SMARTY objective that was determined throughout the past couple of months was by December 2025, the Crime and Neighborhood Safety Action Team will develop a community resource guide and conduct 5 workshops to promote neighborhood safety and reduce homicide and non-fatal shootings. So I'd like to point out that the 5 is highlighted. That is part of the target setting. We would like to figure out as a group, what is the achievable number of workshops we think we'll be able to achieve by December 2025. And in the context, you'll be able to see where we currently stand with some of the the counts for non-fatal shooting and homicides this year and how that has changed since the prior year. What I'd like to focus more so on are the deliverables and the metrics. So the deliverables that we've stated will be completed by the end of December 2025 are a resource guide and hosting workshops. So today, what we would like to focus on in the target setting activity is, would we like to focus more on number of people reached, number of resource guides distributed, or is our focus more so on the knowledge increase that are gained from these workshop sessions? And if we would like to do more of the knowledge increase, that would probably look at something like doing a pre and a post survey to see that knowledge increase. So these are just some thoughts I'd like you to keep in the mind when you go through the Google Slides. And if we could hop over to the Google Slides, Alex.
And for just while you're doing that, for those, um, I will, for those that are in the meeting, I will, because some of you don't have the actual link, so I'm going to put the link in the chat so you can be able to have access to the Google Docs and be able to put your input in.
Savani already got that.
Oh, okay. Okay.
Yeah, that's all right. You've got multiple links there, folks, to get yourselves to this shared Google slide.
So what we would like to do is, so I can't really see. So we'll be giving everyone 5 minutes just to reflect on their own and use the Google Slide link to jot down some ideas. So there's 2 slides. There's a total of 5 questions for each section. So we ask that you try to budget roughly a minute for each question if possible. If you have more thoughts on one question as opposed to others, they'll feel free to spend more time on one. So we ask that you try to limit each card to one idea and 3 to 7 words max so we can get a quick glimpse at what targets you think are appropriate, just so we can get a quick scope. And in the second slide where you see 4 different questions, those are focused more so on questions related to the input activities or implementation partners and anything that is relevant to the strategy itself. Robert, is there anything you'd like to add to that?
No, you did that said that perfectly. So if you could at this time, we will go back to the slide, Alex, if you could, where the Smarty goal is. And you can go into the Google Doc and provide your feedback and input. And we will give 5 minutes for you to complete that for the crime and neighborhood safety section. And if there's any question, feel free to put it in the chat. Or if you're having any issues with getting to the Google Doc, feel free to put that in the chat as well. And then we will come back and we will have a discussion regarding the feedback that we're receiving.
I'm seeing folks typing on those cards on the slides, so that is perfect. Remember, we're on slides 1 and 2 for crime and neighborhood safety. Click on the little colored boxes and that should let you type. If you cannot type, multiple of us are watching the chat, so you can put your comments in there and I will transfer it to one of the cards. And on slide 2, where it's set up a little bit more for brainstorming, please feel free to list any organization or partner or other resource that exists. Do not assume we already know about it. So don't worry about, everyone knows this thing. No, please go ahead and list everything so that we can be sure to collect all the information you guys have. About 30 more seconds, folks.
Okay. All right. Well, that was very productive. It was great to see everyone participating. So now we can, if anyone would like to come off of mute to discuss your feedback or what you've provided in the Google slide notes, would be appreciated if there's anyone that would like to share. Or is there any probing questions that you may have?
So I see a lot of great responses. Thank you everyone for participating. One question I would like to ask is, I do see that there's a question about what will the workshop topics consist of? And I do think that is something, Robert, if you'd like to expand a bit more, is something that will be developed along with partner organizations in your monthly meetings.
Yes, thank you. So, just to give a little content, we're with the work group that we have, we've been discussing a lot of um, topics around as far as from the actual groups, organizations. So we have many of topics around like um, gun safety. We've also talked about like resources around specific organizations that are working in violence interruption or any specific educational preventative initiatives around youth, around families, to when it comes to violence prevention. So that's a great question. And then also you can put that if there are any specific topics that you deem relevant to the uh, to us, when it comes to the workshops that we are working to create, feel free to share that with us, and we will provide that in our discussions as we meet on a monthly basis.
Thank you, Robert. And I do see, sorry, is there anyone who else was?
Yeah, Savani, I was just curious because someone added a question about is resources guide distributed important to measure, and curious if you and Robert had feedback on that.
I don't think that, I do agree that our reach is more important than perhaps number of flyers distributed or especially depending on how our resource guide is going to be formatted. If it's something like a website tracking views, we might not be able to look at unique views. So I do think the target of number of community workshops and training youth champions or number of community members reached is more important than the actual guides distributed. That was just a potential metric that we were considering also including along with the other prior to mentioned.
Thank you. I just wanted to make sure that question got addressed when I was looking through it.
Thank you, Alex. And I do have a question. I do see something here about quarterly workshop topics to train youth championship champions and peer mentors. I would like to ask if you're willing to speak up, is that asking us to host community workshops using youth championships and peer mentors to lead the workshops?
Oh, that's a great idea. This is Audrey Burkhardt. I don't know. I think I was just thinking that engaging youth to be mentors to other youth in this space could be really impactful from a training or workshop perspective. So yeah, you could do it that way. Or if there's, some format to train youth on um, opportunities for violence interruption or crime neighborhood safety. I'm not sure what all the resources are that you have access to or what's available. But yeah, I like both ways would work. Did that help? I'm sorry.
Yes, thank you,
Okay.
Audrey. And I think, Robert, maybe that's something you can take back to your work group meetings.
Yes, totally. I totally agree with that. That is something that we can take back and we can evaluate and come up with some solutions.
Can I interject on that topic real quick?
Yes, please.
Um, and I put it on the second slide. Wave has started. We have a youth advisory board, and we just started a youth, excuse me, coalition, um, for CBI and GBP. So, we are just on the ground levels. If anybody can help us identify some organizations that would be willing to be a part of said coalition, could you please, I'll shoot my email in the chat, um, to reach out so we can kind of, right now we have 3 organizations on board. Obviously we would like to have more, but that might help facilitate what was just discussed.
Thank you, Daryl. And I do see a good comment about trying to reach members in hot zone areas. That is definitely something that we would like to prioritize with hosting these workshops.
Absolutely. And I see a comment in the chat from Amanda, uh, and she said that you don't have to do the training yourself. It could be um, a collaborative effort with organizations and groups already set up to do it. I totally agree with that.
Is there any comment that anyone would like to expand on a bit more, either in this slide or the previous slide, before we move on to the next topic area?
I'm curious if anyone has thoughts or ideas on what a plausible number of participants would be for a workshop focused on violence prevention strategies, resource guide, things like that. So does anyone have any ideas that you can add a card, you can put it in the chat, you can say it. Is this a 5-person in a workshop, a 20 people in a workshop? What does anyone have experience or thoughts around that?
I think it depends on the lens that you're taking. If you're working with lived experience partners who have witnessed or have some trauma around safety and crime prevention, and you might want to do a smaller group just because there needs to be a sense of trust for that group to really share. If you're working with professionals, it probably can be a little bit larger.
Great point. I think that's totally fair, especially knowing that those that have are lived experience could have some trauma or or it needs space to really be able to express what their coping mechanisms and things like that. And so I think you're told that that's totally fair to consider. Any any other questions, comments?
Bert, can you bring up the Smarty goal again, really quick? Or whoever's controlling it.
Sure.
Thank you. So are there going to be different topics in the workshops? And I apologize, just to promote neighborhood safety and reduce homicide, non-fatal shootings. And then as they're developed, they'll each hone in on specific issues.
Yes, and thinking about the context, because we will be working in collaboration with VR Fast, which is the Violence Response Public Health Safety Team. And so they're with MCW, and they have real-time data to show what are some specific upticks of, that, and we are always in the meeting assessing, root causes or uh, factors that played a part into a lot of the homicides and non-fatal shootings. So that is an opportunity for us to really learn what we could um, um, tailor our workshops. And so I think that would be something that our group would be able to be able to address in real time.
Thank you.
No problem.
Alex, if you could go to the next slide, we can move to harm reduction and consideration of time. So the SMARTY objective for harm reduction was by December 2026, the MKE SSC subcommittee will publish a policy brief advocating for a city ordinance to reduce drug paraphernalia fines to reduce drug-related harm in Milwaukee. This policy brief will incorporate feedback from at least 3 community forums and consultations with 5 key stakeholder organizations to ensure broad community input. So the key metrics we're hoping to set target for are number of community forums and key stakeholder organizations to include in the policy brief development. And one question, and Robert, maybe this is something you can answer, or this is something that can come up through the comments, is are we hoping to include this feedback after we draft a policy brief and present it to them, or are we looking to initially seek their feedback prior to development of the policy brief itself?
Would you like me to answer, Robert?
Yes, that would be great.
Yeah, so we are hoping to use the input from the community forums and the amount of key stakeholders to inform the policy brief. So that would happen prior to the policy brief being finalized.
Thank you, Alex.
Yep.
And if you would like to go over to the Google Slides, we can start with getting some comments. And
All
like
right.
before, we have 2 slides. The first slide for target setting and the second slide for more of that brainstorming around the strategy itself.
I know it's a little bit long. I just copied and pasted the Smarty goal in there, so we have the language on the Google slide as well. If we need to leave the cards off to the side so we can read everything, or you can cover up that language. Or make it teeny tiny, so nobody can read it anyways. I'm kidding, Alex. And again, the numbers in the brackets are some key targets that we're trying to get confirmed. Are these reasonable numbers?
We're going to take about 5 minutes.
The slides are in the same format as before, so you can look at slides 4 and 5. Don't hesitate to put duplicate responses. If you already see a card with something you like, you can either still repeat it on another card, or you can put something like +1 on that card to show where there is broader consensus.
And I just want to add, along with the community forums, we're hoping to also do key informant interviews with people with lived and living experience outside of the community forums, just to add context.
People everywhere are recommending GoodRx.
My neighbor showed me the app.
About 2 minutes. All right, just about 15 seconds left.
Okay, so again, thank you all for taking a moment to uh, complete. And so we just wanted to have a discussion to talk about any other questions or comments that you from your responses. If anyone would like to come off of mute and be brave to just talk about your questions or your comments or feedback.
I thought it was good insight. There's a couple of cards about matching the number of forums or the number of organizations consulted based on the audiences you're trying to reach and making those forums be kind of targeted towards a type of audience, or the number of organizations based on, you know, the service type of those organizations. So those are some good ideas for helping to organize these plans going forward.
Awesome. Thank you, Melissa. All right. Anyone else?
Yeah, I think, you know, there's some opportunity here to think about really intentional criminal justice reform so that um we're not putting people who are struggling with addiction in cages. So that be interested to explore that, and I think connect with other organizations who are doing some criminal justice reform work, and maybe some work they may have done to advance drug related community led drug related responses.
Awesome. Thank you, Tristan. Great point. All right. Anyone else?
I do
This is
see.
Annika. I'm curious what is the plan for getting feedback at the forums? And is there a desired number of people for getting feedback from to include in the policy brief?
The work group hasn't. That was going to be our next conversation at our next work group meeting, which is this Friday at 10, if anyone is interested.
I believe Venetia has her hand up. Go right ahead.
Yes, good morning, everyone. I just wanted to add, because especially to Tristan's point, when we're talking about justice reform, is there an opportunity to have conversations around education and training that's available for first responders and knowing how to, recognizing the education and awareness around mental health, around substance use, knowing how to, and I know there's like the CIT training, but I know there's other opportunities that are available. So I just wanted to add that around justice reform.
That's perfectly said. I do agree there is some correlation and I believe the work group, um, we can take that back to the work group and see how we could incorporate those conversations, and how we could um, flesh out the details for that. Alex, if you, oh, go ahead.
Yeah, I would add that when we use the term first responders, I think it's important to delineate between law enforcement partners and firefighting and EMS, because firefighting and EMS, uh, well imperfect, we don't have the same issues with reaching these communities and interacting directly. In fact, we have specific programs that are extremely successful that we're expanding, such as the MORI program, the Milwaukee Overdose Response Initiative. So I just want to delineate, uh, we seem to get lumped in with the title first responders a lot, and fire and EMS have incredibly proactive means of doing this, and not trying to throw any shade at all. I am actually just trying to give props to my crews that have worked very hard to do that. So really appreciate that. Thank you.
No, thank you, Chief. Appreciate it.
Hey, can I hop back in, Robert?
Oh, absolutely.
Thank you,
Absolutely.
Chief. You know, I appreciate you so much. So, you know, thank you for providing, you know, the difference between the two. So I really appreciate that.
Thanks, Phoenicia. I really appreciate you too.
Hey, Robert, I got something too. Hey, everyone, how's everybody doing? I was the one that added in about the harm reduction workshops to support education on resources and available alternatives. I'm actually looking at doing something on my own as far as for working with one of the with CanI and actually doing a plant-based medicine workshop as far as for teaching alternatives for you know, whether it's for pain management and things of that nature, anxiety and stress. So I was just curious if we're looking at wanting to do something like that as well, as far as for bringing that up, because I know we're kind of looking at just as Chief said, you know, we're looking at all the other areas, but still just making sure we're also touching, you know, the touch point of the community as well too.
Awesome. Thank you so much for that. I again would say that we value everything that has been said, and hoping that we could continue to expand our reach and being intentional. And so, if you have not put it on the cards, or if there isn't any space where you will that isn't appropriate, feel free to let me know or reach out to Alex, who is facilitating the work group. And we definitely are open to anyone being a part of that group as well, as she expressed, if there any interest. And we meet every fourth Friday of the month. So if anyone can make it, feel free. We value your input and your attendance and participation. Okay, any other? This is great conversation and discussion. Truly appreciate everyone's input. Is there any other burning questions, comments that you would like to share?
Hey, this is Deshaun. I do have a quick one. Speaking of law enforcement, MPD, do we have any representation on the call or in this work group? And if so, are there any comments or thoughts around this? Or how do we reach out and bring them into the conversation if they're not present?
Yeah, Deshaun, really great question. So there isn't anyone from the Milwaukee Police Department that's currently in the work group. That being said, there's members of the work group have really great connections with the Milwaukee Police Department. One being we were able to get some data about how many drug paraphernalia fines that are given in a year, which is a huge surprise. It's extremely low. And so we've been able to kind of have a connector to the Milwaukee Police Department, but maybe this is to be intentional, kind of pushing it forward to maybe inviting them into that space. So I think it's important. When we talked to Rick Rose, who helped pave the way for Dane County to drop all drug paraphernalia fines down to $1, he said his biggest supporter was the Sheriff's Department. And I know that we have to get them on board for this to be effective. So thank you for being intentional with that question.
Awesome. Thank you, Deshaun. I appreciate that question. Anyone else?
One thing I would like to add is I do see a comment about monitoring long-term overdose death rates over time. And I would like to add that across all of the Smarty objectives, we will be monitoring what is going on with trends for each area. That was just not our focus for today, since we are trying to set what our targets are for our short-term objectives. But be sure we will be monitoring those and providing those as well.
Well, no, I just jumped into another one.
And And Alex, in the interest of time, if you want to jump to the last section. So for mental health, the Smarty objective was the SSC mental health work group will engage with at least 10 Milwaukee public, private, choice, and or charter schools to discuss the importance of shaped mental health needs assessments and aim to secure at least 3 schools to complete a shape assessment by the end of the 2025 to 2026 school year. So for this, we're hoping to set some targets around how many schools we would like to start the conversation with about the importance of the shape mental health needs assessment and how many we're hoping to secure completion of by the end of the next school year.
Okay, so now you can go right ahead into the Google Doc. And for those that are coming on later, I will provide the link in the chat. And you can go right into slides 7 and 8. And will, if you could go ahead and provide your feedback and questions, would be appreciated. Give me about 5 minutes.
2 minutes left.
School that prepares you for life beyond the classroom.
About 15 seconds left. Go ahead and bring it back, Robert.
All right, awesome. Thank you. Appreciate again all your feedback and great um, thoughts in the Google slide. So if there's anyone that would like to now come off of mute to ask any questions or share any thoughts that you may have from our work session.
I do. Hello everyone. This is Deslin. This is my first meeting with this particular group. And I just want to say with all of these things that connect together with the violence in our community, I am with an organization that is the longest CVI organization, Community Violence Interruption Organization. We started with the 414 Life team. We do have another team. I've been corresponding with people outside of Milwaukee and other states and going and learning how what they're doing. One of my tactics is I kind of go to the community. And I think one of the things that's missing in this space are some of these voices that are actively affected by this piece, because the mental wellness of everyone, the drug addiction, and then the violence, they kind of go all hand in hand. And like separating mental wellness from substance abuse, they're kind of go hand in hand. But I think I'm eager to be more on this, but I think too, getting more voices from people that are directly affected, meaning if we go into some of these treatment centers, go into some of, just like we speak to some of the perpetrators and victims of violence, or, people that are directly affected, for one, and two, going more when we talk about the schools, starting at a very younger age. I mean, every day we're seeing younger and younger people. And when we start educating too around the safety, safe gun violence safety, we do have a nationally firearm gun safety trainer on our team now that gun safety, just telling us like fire is hot, and things, just simple breaking it down. I don't know if that makes sense to everyone, but I think we got to get to a younger population a bit quicker with these forums, as well as not expecting these people to come to where we're at. Having a group of people that may want to go to where they're at, that kind of works for us too. And I think that's all I wanted to add.
Thank you so much, Desaline. Appreciate your candidacy, your thoughts and comments. And I do see that as an area that is greatly needed, especially around like the schools and the youth. And so I believe when it comes to the shape assessment, I know it speaks more to mental health at a system level and assessing the readiness, and also providing some support after doing the assessment. So there is ways that we can be creative in this, and we can also go back to our work group, and I know you're a part of that as well, to touch on like, and we did talk about what supports that we'll have readiness for when the assessment is completed, to provide supports to some of the youth in the school. So that your comments are right on point. Any other questions, comments, thoughts? Okay. So looking at some of the comments around some questions as far as curious to what the tool is currently utilizing by MPS. There are that is a question that we're um, observing, and and just to give it also some content, we don't necessarily, as far as the work group, have a direct contact to MPS just yet. But we do have connections of those that do have readiness connections for MPS schools. However, we don't want to just focus on MPS schools. We want to focus also on charter and private schools as well. So like we're hopeful that we will be able to make those connections, and also providing some outreach to these schools to make those connections. But just thinking about like what tools that they have, that's something that we're also in the work group and in progress of learning more about.
And some additional context for folks not on this particular work group. The United Way Empowering Minds Initiative is doing this as well. They're doing it much more expanded, obviously, and will be providing additional supports. And they, like Robert said, are looking at not just MPS schools, they're looking at all types of schools in counties surrounding Milwaukee, as well as within the city. And so this goal was identified as a way to, extend and expand upon their work, like try to keep going and bring it to even more schools.
Go right ahead, Jim.
Thanks for the plug, Melissa. Yes, and just a little context. So we have a funding relationship with schools. We'll be expanding, but we have information sessions that will be scheduled in January and then just through the networks. I think that that's a very helpful way for us to say, here's what United Way does, and here are ways that you can be engaged at the broader community level and find other supports, whether or not you're adopted into the partnership. So I'm not sure whether our non-disclosure agreements allow us to say here's who's applied or not. But what I can say is that at those info sessions, that's something we can certainly plug and connect and say, no matter whether or not you're adopted into the funding relationship, there's resources available to you to be part of this network and this cause.
Awesome. Thank you so much, Jim. And we truly appreciate the partnership. Any other thoughts, comments, questions? Okay. For the sake of time, we're going to, I believe if Savani, do you have anything else that you would like to emphasize or share your thoughts?
No, thank you everyone for participating in this. I think Robert will probably take this back to your individual work group meetings and make sure we're able to finalize on that target for each Smarty objective. And we can probably share it back as a larger group.
Absolutely. Awesome. Thank you so much. I appreciate it. We can go back to the slide deck for the PowerPoint. Okay, next slide. All right, so really quick, I wanted to touch on the equity activity that we as an action team completed in quarter 1 and and just to give a debrief, next slide. So this was a Menti that we did to establish what what community-based organizations look like and defining what community power building organizations look like. And so we know that as far as community-based organization, there are nonprofit, non-governmental, and charitable organizations. And then the community power building are organizations that are committed to base building and community organizing. So wanted to share the actual results. Go right ahead to the next slide. So these are the community power building organizations that you all shared. And so whose voices do we want to hear? So these are a number of results that you all provided. So we have Latino community, marginalized community in recovery, elders, educational figures. So I don't want to go through all of them, but you can see here the results and it's very vast. And so we definitely want to include all of these voices in this process for our within our action team and our work groups as we move forward to our strategies and goals. Next slide. And as far as your results to what the community power building organizations look like, these are some of the results that you all have shared. So the Fruit of Islam, the Faith Communities, Expo, Project Returns, among American Women's Association, Health the Hood, or I don't know if that's Heal the Hood. It might be Common Ground, NPS, Culture Design, Milwaukee Police, AART, um, charter schools, health providers, LIT, North Division Alum Group, HMP. These are all that you all shared and truly appreciate you sharing them. And if any of you have any connections or contacts that you would like to share, please share it with me. I would love to meet with them and to be able to help build on what we're doing and what they're doing as a whole. Next slide. So some other community meetings in Milwaukee that's going on that we will definitely continue to observe and be a part of is the Block Clubs, Common Council, Prevention Collection, BHS, Havenwood Summer Concert Series, and Covernut Cookout Crime and Safety meetings. So these are all meetings that we are we are already attending, and then some that we will be attending and making those connections. So appreciate your feedback. Next slide. All right, so now we're going to do the MKE MKE Elevate evaluation. So if you could use your phone or go to your to Mentee.com and enter this code, we would love to hear your feedback about how MKE Elevate is doing, and how we can be better in the next year. So again, if you could share, you could take a picture or use your camera, use your camera to the QR code, or go to www.mentee.com and enter the code 37047478. And we will gather all of that information. We appreciate it. We definitely want to make sure that we're doing our best in going forward in evaluating our processes. So, and how we can be better in serving you all. So, so you can take a moment to do that. I'll just leave it up for about about a minute, so you can get it. All right. Okay, next slide.
Hey, Robert, can you just hold that for just a sec? When I do it on my phone, it kind of dead ends me. I
Oh,
just got,
yeah.
yeah, just
No problem.
Yeah, I just tried to join as well, and it is saying waiting for presentation to start. Someone might need to log into the Mentee and click go or something. I did
Yeah.
put the website information in the chat, so if we change our screen, you all can still